Welcome to our comprehensive overview of the key clinical aspects of embryology. This knowledge is crucial for future physicians like you to understand human development, congenital anomalies, and the mechanisms behind various diseases. Over these next few chapters, we will delve into the intricacies of embryological development and its profound impact on clinical practice. From the earliest stages of development to birth and beyond, embryology provides critical insights into the origins of health and disease. So let's get started and unlock the fascinating world of clinical embryology together. Every year, countless children are born with congenital anomalies, or birth defects. These can range from mild variations to serious medical conditions, and understanding their root causes is crucial for effective diagnosis, treatment, and prevention. By studying the intricate processes of embryonic development, we can pinpoint when and how these malformations arise. Take neural tube defects, for instance. These occur early in pregnancy when the neural tube, which forms the brain and spinal cord, fails to close properly. Similarly, cardiac defects can be traced back to errors in the formation of the heart's complex structures during embryogenesis. Understanding these developmental processes helps us identify potential risk factors and develop strategies for prevention. By understanding how teratogens disrupt critical developmental pathways, we can educate expectant mothers about potential risks and empower them to make informed choices. Imagine a construction site where the foundation is being laid, walls are going up, and intricate wiring and plumbing are being installed. Just like a building, a developing fetus goes through highly sensitive periods where specific organs and systems are forming. These are known as critical periods of development. During these periods, the developing fetus is most susceptible to damage from environmental insults such as exposure to toxins, infections, or nutritional deficiencies. Disruptions during these crucial times can lead to congenital anomalies. For instance, limb development occurs in a specific time frame, and exposure to certain medications during this period can lead to limb defects. Understanding these critical periods helps healthcare providers counsel pregnant women about potential risks associated with exposures at various stages of pregnancy. By identifying and mitigating these risks, we can help ensure the healthiest possible outcomes for both mother and child. Infertility can be a heartbreaking journey for couples hoping to start a family. Thankfully, assisted reproductive technologies, such as in vitro fertilization, offer a beacon of hope. Embryology plays a pivotal role in the success of these procedures. By understanding the intricacies of fertilization, early embryonic development, and implantation, embryologists can optimize lab conditions to mimic the natural environment within the female reproductive tract. This includes factors like temperature, pH, and nutrient availability, all crucial for healthy embryo development. Embryologists carefully monitor the development of embryos conceived through IVF, selecting the healthiest ones for transfer. This careful selection process significantly improves the chances of successful implantation and pregnancy. By studying these factors, researchers and clinicians are constantly refining ART techniques to improve success rates and help more couples achieve their dream of parenthood. Imagine peering inside the womb, visualizing the developing fetus with clarity. Advances in medical imaging have revolutionized the diagnosis and management of congenital disorders. Ultrasound allows us to assess fetal growth and identify structural abnormalities. For example, it can detect diaphragmatic hernia, where abdominal organs migrate into the chest cavity. Fetal echocardiography enables prenatal diagnosis of congenital heart defects. Early diagnoses allow for timely interventions at specialized centers. Understanding embryological origins helps interpret imaging findings. Early diagnosis and intervention improve outcomes for babies with congenital disorders. Our genes, passed down from generation to generation, hold the blueprint for life. Embryology and genetics are intricately intertwined, with genes orchestrating the complex choreography of development. Understanding this interplay is crucial for unraveling the mysteries of genetic disorders. Take Down syndrome, for example. This condition arises from an extra copy of chromosome 21, leading to characteristic physical features and developmental delays. By studying how this extra chromosome disrupts normal embryonic development, we gain insights into the underlying mechanisms of the condition. Similarly, Turner syndrome, a chromosomal disorder affecting females, results from a missing or incomplete X chromosome. This genetic alteration leads to specific developmental abnormalities, including short stature and ovarian insufficiency. Marfan syndrome, a genetic disorder affecting connective tissues, provides another example. Understanding how this gene influences the development of connective tissues from the earliest stages of embryogenesis is key to developing targeted therapies for this condition. From the rhythmic beating of the heart to the intricate workings of the digestive system, each organ in our body develops from a cluster of cells in the embryo, following a precise and coordinated sequence. Understanding this symphony of organ development is essential for diagnosing, treating, and managing a wide range of clinical conditions. Cardiac embryology, for example, is crucial for understanding congenital heart defects, the most common type of birth defect. Pulmonary embryology is essential for understanding respiratory conditions that can arise from developmental abnormalities, such as pulmonary hypoplasia or underdeveloped lungs. Gastrointestinal embryology helps us understand and manage conditions like Hirschsprung's disease, where nerve cells are missing from a portion of the colon, leading to bowel obstruction. These are just a few examples of how embryology is woven into the fabric of clinical medicine, guiding our understanding and management of various organ-specific conditions. Pregnancy is a journey filled with anticipation and uncertainty. Prenatal screening offers valuable information about the baby's health, identifying potential concerns early on. Embryology guides these tests, helping us understand what to look for and when. Ultrasound assesses fetal growth and anatomy, detecting structural abnormalities. Measuring nuchal translucency can identify risks of chromosomal abnormalities and heart defects. Blood tests measure biomarkers indicating risks of chromosomal abnormalities or neural tube defects. Prenatal screening empowers parents with knowledge to make informed decisions and prepare for challenges. The womb, once considered an impenetrable sanctuary, is now a frontier of medical innovation. Advances in fetal medicine and in utero surgery are transforming care for the tiniest patients. Consider spina bifida, where the spinal cord doesn't close properly. Fetal surgery can significantly improve outcomes. Twin-twin transfusion syndrome is another example where fetal intervention can be life-saving. Laser therapy can restore balanced blood flow, improving survival chances for both twins. Expanding knowledge of embryology will enhance our ability to treat congenital conditions before birth. Cancer, a disease often perceived as a breakdown in the body's control mechanisms, has surprisingly deep roots in developmental biology. Embryology, the study of how life begins, can shed light on how cancer develops and progresses, offering new avenues for treatment. During embryonic development, cells divide rapidly, differentiate into specialized cell types, and migrate to their designated locations. These processes are tightly regulated, ensuring that tissues and organs develop correctly. Cancer, in many ways, can be seen as a disruption of these developmental processes. Cancer cells often exhibit uncontrolled growth, loss of differentiation, becoming more like primitive cells, and the ability to invade surrounding tissues and spread to distant sites, all hallmarks of early embryonic development gone awry. Understanding the molecular similarities between embryonic development and cancer progression is a burgeoning field of research, offering hope for developing more effective and less toxic cancer treatments. Embryology isn't just about understanding what can go wrong during development. It's also about empowering health from the very beginning. By applying embryological knowledge to public health initiatives and preventive medicine, we can significantly reduce the incidence of birth defects and improve maternal and child health outcomes. One of the most compelling examples is the use of folic acid supplementation during pregnancy. Folic acid, a B vitamin, plays a crucial role in cell division and DNA synthesis, processes essential for the proper development of the neural tube, which forms the brain and spinal cord. Studies have shown that adequate folic acid intake before and during pregnancy can significantly reduce the risk of these birth defects. This simple, yet powerful intervention, rooted in embryological understanding, has prevented countless cases of neural tube defects, protecting babies from potentially devastating disabilities. As we've journeyed through the remarkable world of embryology, we've seen how this field illuminates the complexities of human development and its profound impact on health and disease. From understanding the causes of congenital anomalies to guiding the development of groundbreaking medical technologies, embryology is shaping the future of medicine. A solid understanding of embryology equips future physicians to better diagnose, manage, and prevent developmental abnormalities, enhancing patient care from conception to birth. Thank you for watching.